Your autoimmune disease is just a label. It means your body's out of balance. Stop thinking your only answer is to load up on pharmaceuticals. They're just masking what's going on and will end up throwing your body even more out of balance. There is another way. The most common conditions you probably heard of are multiple sclerosis, MS, lupus, rheumatoid arthritis, Crohn's, ulcerative colitis, psoriasis, celiacs, type 1 diabetes, Hashimoto's thyroiditis, Graves' disease, even chronic fatigue syndrome and fibromyalgia have some elements of autoimmunity. These types of conditions have been rising sharply the last 2 decades, with something like 50 million people now in the US alone diagnosed with at least one. And if you have one autoimmune condition, you're at high risk for another. Millions of people are struggling with various symptoms without actually getting a particular diagnosis. Things like digestive problems, allergies, asthma, brain fog, even depression, skin problems, hair loss, headaches, infertility, joint and muscle pains, sleep problems. These are all warning signs of a damaged immune system and a red flag of what's going to come down the line if steps aren't taken to reverse this process. Don't worry about getting a diagnosis if you haven't got one yet. It really is just a label. There's actually over 100 different autoimmune conditions, but they're not well understood by conventional physicians. Part of the problem is the specialization of care in conventional medicine. You go to a neurologist for MS, a rheumatologist for RA, a gastroenterologist for celiac disease and Crohn's, an endocrinologist for Hashimoto's or Graves', and if you have more than one condition, then you're managing multiple doctors. There's actually more similarities than differences between each of these conditions. A pill is not going to fix it. The side effects from these particular conditions are really pretty common and disruptive. So first you've got your anti-inflammatories, NSAIDs, your non-steroidal anti-inflammatories like Advil, Aleve, that's naproxen, Motrin, ibuprofen. They're obviously used for all types of inflammation, including joint and muscle pain and headaches, but they really wreck your stomach. You may start with just gas or heartburn, a bit of nausea, some constipation or diarrhea. You might get some vomiting, ultimately stomach pain. You might even not recognize that the symptoms you're getting are tied back to these over-the-counter meds you started popping. Then ratcheting it up, your doctor's probably going to prescribe steroids like prednisone, and you feel great when you first get on a steroid and you think that it must be working and life is worth living again, but in fact it's just suppressing your immune system. There's often weight gain with steroids, increased blood sugar, mood swings, depression's very common on steroids, sleep problems, heartburn, acne, muscle cramps. But it's the slow damage that you're not seeing every day with linkage to cardiovascular and increased cancer risks linked to steroid use. Then upping the ante, especially if you wind up at a specialist, you're going to get put on the so-called disease-modifying anti-rheumatic drugs like Celcept or Enbrel. Methotrexate is a particularly nasty drug, also considered chemotherapy to treat cancer. The side effects of each drug differ, and obviously by individual, but they include risks of serious infections, decreased red and white blood cell counts, bruising, excessive bleeding, fatigue, swelling of limbs, lymphoma, skin cancer, high blood pressure, heart failure, hepatitis, nervous system problems, anemia, hair loss, shingles, mouth sores, irreversible lung damage. They're really interfering with the natural processes in your body, including DNA repair and cell replication. So then, even beyond that, maybe you get prescribed a biologic drug like Humira, which interferes in how your immune cells communicate with each other. Just another compound trying to trick nature, but more nasty side effects ensue, including, again, hepatitis, but tuberculosis, full body bacterial infections, allergic reactions like hives, swollen face, numbness or tingling in your joints, blood problems, liver problems, headaches, and again, another increased risk for cancer. Okay, so what do you do instead? Autoimmune conditions can be crippling, and people have been known to commit suicide from the pain and disability. There is hope, even for those that are currently bedridden, but you have to get at the root cause. Often it's a case of leaky gut, a damaged digestive system. So the walls of your intestines actually start leaking substances into your bloodstream, perhaps toxins, but also unfriendly microbes and partially digested food. And then your body's just reacting to those substances, and that's when you're getting symptoms. Many medications can contribute to leaky gut, especially antibiotics, which are damaging the microbiome. Can lead to yeast overgrowth or SIBO, small intestine bacterial overgrowth, but also steroids can cause problems, acid blocking medications, even birth control pills. You could have food sensitivities. Gluten is a really big one with autoimmune conditions. Even if you don't think gluten's upsetting your stomach, it can be creating havoc in your body. Cutting out gluten entirely can make a really massive difference. Grains can be a problem, legumes, certain vegetables, the nightshades in particular. Cutting these out can be a temporary solution until your body's working better. Serious autoimmune conditions can respond really well to more of a keto diet or a carnivore's diet because of the difficulty of digesting these really healthy carbs, but it can be a problem in the short term when your gut is impaired. Stress is a really big contributor to autoimmune symptoms, both physical stress like a lack of sleep or illness, but emotional trauma and family pressures can really instigate a full-blown autoimmune condition. Ongoing infections can be a root cause, like Epstein-Barr virus, Lyme disease, which is bacterial in nature, Candida overgrowth, which is really a fungus, but also mold in your house or workplace. Maybe you picked up a parasite from some bad sushi that you had. So addressing these infections using a natural approach is usually a really good place to start. We'll dig into infections in a separate video. There's a lot going on in there. But eliminating the cause is going to be a key part of the plan. But there are a number of remedies that are going to help in any of the situations. Anything to do with your immune system, vitamin D is going to be critically important. Get your levels tested. Conventional docs are happy with levels of something like 25 nanograms per milliliter, but you really need it to be nearer 75. So really supplement. 5,000 international units a day is really a baseline. You're probably fine on 10,000 units a day, certainly for a period while you get your levels up. I'd prefer you to get your vitamin D from going out in the sun, so you should be doing that anyway. Try and get outside before noon every day, or any time the sun is out, you need to be in it. So do that anyway, but if you're really suffering from symptoms, then supplementation is going to be important, and probably in the winter as well. Probiotics or fermented foods, or that should be an and/or, but fermented foods are wonderful for you. You really need to restore your gut health and your microbiome. Digestive enzymes can be helpful as well to make sure that you're fully digesting the food that you're eating. Again, probably a temporary measure until your gut can start to heal. Cod liver oil or krill oil is really wonderful for inflammation. Turmeric, also fantastic for inflammation. Put it in your food, take it as a tincture, take it as a supplement if you want. Make sure there's some black pepper in it to help with absorption there. Bone broth is really wonderful. Drink it instead of coffee in the morning. I have bone broth every day that's actually been infused with turmeric. So just really wonderful for any conditions and stomach problems. These are all really useful remedies, but you have to fix your food. You've got to cut out the ultra processed food, anything processed. Avoid the industrial seed oils, the corn oil, canola, sunflower, safflower. Make sure you're eating organic whole foods. Cut out any kind of fast food. You won't just feel better from your autoimmune condition, you're going to be really improving your overall health and longevity. Now, after all of that, if you're really doing all of that really well and you're still in pain, or maybe you've been on medication for a while and you want to wean off, but you're worried about a sort of immediate backlash initially, there is a pharmaceutical that I do support. It's old school, and Big Pharma ignores it because the patents ran out years ago, but it's non-toxic and it is safe for long-term use. It's low-dose naltrexone. And I've written a whole article on LDL, which you can find in the notes, but we've probably chatted enough here for today. So until next time.